Dr. Paul Mason, insulin is the driver of obesity, from his Low Carb Down Under presentation. Ever wonder why half of Americans, following doctors' or trainers' advice, don't lose weight? The advice? Cut calories and exercise. What does work? Cut carbohydrates, which cut insulin. Excess insulin is the fat storage hormone. In this video, Dr. Paul Mason explains why.
I'd like to introduce you to one of my patients. Now, this is the kind of patient that, as a doctor, I love. She was very, very compliant. So she first came to my clinic with joint pain, and she was overweight. And it was very clear to both of us that if she could lose some weight, that would help her condition. She was following the conventional advice. She was slavishly following that advice. She was exercising, she was eating low fat, but the trouble is it was not working. At the time she saw me, she was 30 kilograms overweight, so the patient's following the medical advice that they've been given. Is it the patient or is it the doctor? So I would argue the blame should actually lie with the doctor or the health professional.
I would argue that the blame should actually lie with the doctor or the medical professional.
Because the implication of the advice is that if you fail to lose weight, you're lazy and you're greedy. You're just not trying hard enough. But this very premise overlooks the key essence to understanding weight loss, and that's hormones. The conventional calories in, calories out hypothesis ignores the effect of hormones. A very strong science.
Hormones, the conventional calories in, calories out, ignores the effect of hormones.
This boy here, 3 years old, he weighs 42 kilograms, and he's got a problem with a hormone called leptin. 7 years old, he now weighs 10 kilograms lighter and a very healthy weight. See what happens when you fix the hormone problem?
Hormones. See what happens when you fix the hormone problem?
Now, the most common hormone in the population that causes obesity, it's called insulin. And this lady has a problem with insulin, but she's got a unique problem. She's got a tumour that secretes insulin, pumps it into her circulation. In this picture, she's 107 kilograms and she's only 152 centimetres tall. She had an operation to remove the tumour, which lowered the insulin levels in her body. Her weight dropped to 89 kilograms. She lost 18 kilograms. And if we have a look at a graph of her weight loss, you can see that in a 10-day period, she lost 14 kilograms. So clearly there's a problem here with insulin. It makes you fat.
She lost 14 kilograms in 10 days. Clearly there is a problem with insulin that makes you fat.
This patient also had a problem with insulin. This was one of my patients. You can see her here, 46 years old and a size 20. This is what happened when we fixed her insulin problem. She lost 40 kilograms, and here she's about a size 8. The big difference is she didn't have surgery to fix her insulin problem. We changed her diet.
She did not have surgery. We changed her diet.
The height of the lines there represents how much insulin your body's releasing. And each of those individual lines represents one of the 3 main sources of energy in our diet: carbohydrates, protein, or fat. So let's have a look at carbohydrate. Let's see what happens when you eat carbohydrate to your insulin levels. You get a massive and prolonged release of insulin for over 2 hours. Fat is even less. High levels of insulin are associated with obesity, and carbohydrates are the most potent stimulus we have for our bodies to release insulin. So in order for us to lose weight, we need to control our insulin level, ergo, we need to control our carbohydrate intake.
In order for us to lose weight, we need to control our insulin level. Ergo, we need to control our carbohydrate intake.
Between 2003 and 2018, there were 62 published randomized controlled trials comparing low carbohydrate diets less than 130 grams a day to low fat diets in terms of weight loss. 31 of these studies had statistically significant findings. So I've graphed these 31 studies that had statistically significant findings, and I've compared the average weight loss on the both diets. The low carbohydrate diet is depicted in blue, and you'll note that in every single one of these studies that we've got here, the low carbohydrate diet led to more weight loss than a low fat diet.
The unbiased evidence shows in published randomized control trials, in every study, low carb reduced weight more than low fat.
Whatever happened to my perfect patient? She cut the carbs out of her diet and she increased the fat. And by doing that, she fixed her insulin problem. And then this happened. She's maintained a loss of 36 kilograms and she lost 28 centimetres off her waist. And these are her actual photos. You are not to blame for being overweight if you've been following bad advice.